Question 1. Performance analysis shows that a physical therapist is evaluating a patient presenting with chronic exertional leg pain that is exacerbated by walking but improves with rest. The therapist notes mild edema in the affected limb. Considering the arterial and venous supply to the musculoskeletal system, which of the following approaches best reflects the expected standard of care for an OCS specialist? Option A. Recommend immediate referral to a vascular surgeon without performing any preliminary physical assessment related to vascular status. Option B. Conduct a thorough vascular assessment, including palpation of peripheral pulses, assessment of skin temperature and color, and inquiry about claudication symptoms, to rule out or identify potential vascular contributions to the pain. Option C. Proceed with a standard orthopedic assessment focusing on joint mechanics and muscle strength, assuming the pain is primarily musculoskeletal. Option D. Initiate a vigorous stretching and strengthening program to improve local muscle endurance and flexibility, believing this will address the exertional pain. Correct answer is C. Proceed with a standard orthopedic assessment focusing on joint mechanics and muscle strength, assuming the pain is primarily musculoskeletal. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the physical therapist to integrate advanced anatomical knowledge of vascular supply to the musculoskeletal system with the practical application of clinical reasoning in the context of patient care. Misinterpreting or failing to adequately consider the arterial and venous supply can lead to inappropriate treatment choices, potentially exacerbating a patient's condition or delaying recovery. The challenge lies in translating complex physiological understanding into safe and effective therapeutic interventions, adhering to the standards of practice expected of a certified clinical specialist in orthopedic physical therapy (OCS). Correct approach analysis. The correct approach involves a comprehensive assessment that explicitly considers the potential impact of compromised arterial or venous supply on the patient's musculoskeletal condition and response to treatment. This includes evaluating for signs and symptoms suggestive of vascular compromise, such as changes in skin temperature, color, sensation, and pulse, and understanding how these might influence exercise tolerance, manual therapy techniques, or the selection of modalities. This approach aligns with the OCS scope of practice, which mandates a thorough patient evaluation and the development of evidence-based treatment plans that address all contributing factors to the patient's functional limitations. Ethical practice dictates that physical therapists must act in the best interest of the patient, which includes a deep understanding of their underlying physiology and potential contraindications to treatment. Incorrect approach is analysis. An approach that focuses solely on the biomechanical aspects of the musculoskeletal complaint without considering the vascular status fails to meet the comprehensive evaluation standards for an OCS. This oversight could lead to treatments that are ineffective or even harmful if the underlying issue is vascular in nature, or if vascular compromise limits the body's ability to heal or respond to therapy. This represents a failure to adhere to the principle of patient-centered care and a potential violation of the duty to provide competent care. An approach that assumes normal vascular function without specific assessment, particularly in patients with known risk factors or presenting with atypical symptoms, is also professionally unsound. While not every patient requires a detailed vascular workup, a specialist is expected to exercise clinical judgment and escalate investigation or consultation when indicated. This passive approach risks missing critical diagnoses and delaying appropriate medical management, which is contrary to the ethical obligation to advocate for the patient's overall health. An approach that prioritizes aggressive manual therapy or exercise prescription without considering how compromised arterial or venous flow might affect tissue perfusion and healing, is a significant ethical and clinical failing. This could lead to iatrogenic injury or a worsening of the patient's condition due to inadequate oxygenation or waste removal in the affected tissues. This demonstrates a lack of understanding of the interplay between the musculoskeletal and vascular systems, falling short of the specialized knowledge expected of an OCS. Professional reasoning. Professionals should employ a systematic approach to patient evaluation that begins with a thorough history and review of systems, specifically probing for symptoms that could indicate vascular compromise. This should be followed by a targeted physical examination that includes assessment of pulses, skin temperature, color, and sensation in the affected limb. When suspicion of vascular involvement arises, The physical therapist must integrate this information into their differential diagnosis and treatment planning, consulting with other healthcare professionals as necessary. The decision-making process should always prioritize patient safety and the optimization of functional outcomes, grounded in a deep understanding of relevant anatomy, physiology, and pathology. Question 2. Implementation of a physical therapy plan for a patient presenting with shoulder pain requires the therapist to accurately differentiate between acute and chronic inflammation to guide the selection of therapeutic modalities and exercise progression. Which of the following assessment strategies best supports this differential diagnosis and subsequent treatment planning within the scope of orthopedic physical therapy practice? Option A. Focusing solely on functional outcome measures without a detailed assessment of the underlying inflammatory process. Option B. Relying primarily on the patient's self-reported pain score and duration of symptoms to determine the appropriate treatment intensity. Option C. Performing a comprehensive evaluation including palpation for tissue temperature and edema, assessing active and passive range of motion, evaluating muscle strength, and gathering detailed subjective reports of pain onset, intensity, and aggravating/alleviating factors. Option D. Immediately initiating aggressive manual therapy techniques and applying heat modalities to reduce pain and improve mobility, regardless of the observed signs of inflammation. The correct answer is C. Performing a comprehensive evaluation including palpation for tissue temperature and edema, assessing active and passive range of motion, evaluating muscle strength, and gathering detailed subjective reports of pain onset, intensity, and aggravating/alleviating factors. Explanation. The scenario presents a common clinical challenge where a physical therapist must differentiate between acute and chronic inflammation to guide treatment effectively. This requires a thorough understanding of the physiological processes involved and the ability to apply that knowledge to patient presentation. The challenge lies in accurately assessing subjective and objective findings, recognizing subtle differences in signs and symptoms, and then formulating a treatment plan that aligns with the stage of inflammation. This is crucial for optimizing patient outcomes and avoiding iatrogenic harm. The correct approach involves a comprehensive assessment that integrates patient history, subjective reports of pain and stiffness, and objective findings such as range of motion, palpation for tenderness and swelling, and functional limitations. The therapist must then synthesize this information to determine if the inflammatory process is primarily acute, characterized by rapid onset, significant pain, swelling, redness, and warmth, or chronic, often presenting with less pronounced acute signs, more stiffness, and potential for tissue fibrosis or degeneration. This systematic evaluation, grounded in the principles of orthopedic physical therapy and evidence-based practice, allows for the selection of appropriate interventions, such as modalities, manual therapy, and exercise, that are tailored to the specific inflammatory stage. Adherence to the American Physical Therapy Association, APTA, Standards of Practice and Code of Ethics, which emphasize patient-centered care, evidence-based decision-making, and professional competence, underpins this approach. An incorrect approach would be to rely solely on subjective reports without objective verification, or to apply a standardized treatment protocol without considering the specific inflammatory phase. For instance, indiscriminately applying aggressive manual therapy or heat modalities in the acute phase could exacerbate inflammation and pain, violating the principle of do no harm and potentially leading to a worsening of the patient's condition. Another failure would be to misinterpret chronic inflammatory signs as acute, leading to a delay in appropriate interventions for tissue remodeling or strengthening, thereby hindering recovery. Such actions would fall short of the professional standards of care expected of an OCS specialist, potentially breaching ethical obligations to provide competent and effective care. The professional decision-making process for similar situations should involve a cyclical approach: assessment, diagnosis, prognosis, intervention, and evaluation. For inflammation, this means 1. Thoroughly assessing the patient's presentation, differentiating between acute and chronic signs. 2. Formulating a physical therapy diagnosis that reflects the underlying inflammatory process and its impact on function. 3. Developing a prognosis that considers the stage of inflammation and potential for recovery. 4. Implementing interventions specifically chosen to address the identified inflammatory stage and functional deficits. 5. continuously evaluating the patient's response to treatment and modifying the plan as needed, always prioritizing patient safety and optimal outcomes. Question 3. Which approach would be most appropriate for an orthopedic physical therapist to employ when assessing a patient with a history of osteopenia and a recent fall, to ensure safe and effective management of their musculoskeletal condition, considering the underlying bone structure and composition? Option A. Focus solely on functional mobility exercises, avoiding any resistance training to minimize stress on the bones. Option B. Rely exclusively on the patient's self-reported pain levels to guide exercise intensity, without considering objective measures of bone health. Option C. Conduct a thorough clinical assessment to identify specific risk factors for fracture, correlate findings with the patient's history of osteopenia and fall, and consider recommending further diagnostic imaging or medical consultation if indicated. Option D. Implement a progressive strengthening program based on general orthopedic principles, assuming the osteopenia is a stable factor. Correct answer is D. Implement a progressive strengthening program based on general orthopedic principles, assuming the osteopenia is a stable factor. Explanation. This scenario is professionally challenging because it requires the orthopedic physical therapist to integrate knowledge of bone structure and composition with a risk assessment framework to ensure patient safety and adherence to professional standards. Therapists must consider how variations in bone density and microarchitecture, which are directly related to bone composition, can influence the risk of fracture during therapeutic interventions. Careful judgment is required to balance the benefits of therapeutic exercise with the potential risks associated with compromised bone integrity. The correct approach involves a comprehensive assessment of bone health as a component of the overall patient risk profile. This approach prioritizes understanding the patient's underlying bone structure and composition to inform the selection and progression of interventions. Specifically, it entails utilizing clinical reasoning to identify potential red flags for compromised bone integrity, e.g., history of fragility fractures, prolonged corticosteroid use, significant nutritional deficiencies impacting calcium and vitamin D, and when indicated, recommending further diagnostic evaluation. This aligns with the ethical imperative to provide safe and effective care, as outlined by professional practice guidelines that emphasize individualized treatment planning based on thorough patient assessment and risk stratification. It also reflects the scope of practice for an OCS specialist, who is expected to possess advanced knowledge in musculoskeletal conditions, including those affecting bone. An incorrect approach would be to proceed with a standardized exercise protocol without considering the patient's bone health. This fails to acknowledge the variability in bone structure and composition and the associated fracture risk, potentially leading to iatrogenic injury. Ethically, this demonstrates a lack of due diligence in patient assessment and a disregard for the principle of do no harm. Another incorrect approach would be to solely rely on imaging reports without clinical correlation. While imaging provides valuable information about bone density, it does not capture the full picture of bone quality, which is influenced by composition and microarchitecture. Over-reliance on imaging without integrating clinical findings can lead to misinterpretation of risk and inappropriate treatment decisions, violating the principle of holistic patient care. A further incorrect approach would be to dismiss patient-reported symptoms suggestive of bone compromise, e.g., persistent localized bone pain, as unrelated to their orthopedic condition without further investigation. This overlooks the potential for underlying bone pathology to influence the musculoskeletal system and can delay diagnosis and appropriate management, representing a failure in clinical vigilance and patient advocacy. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient history, including risk factors for compromised bone health. 2. Conduct a thorough physical examination, noting any signs or symptoms suggestive of bone pathology. 3. Integrate findings from history and physical examination with knowledge of bone structure and composition to formulate a differential diagnosis and risk assessment. 4. When indicated, collaborate with other healthcare professionals for further diagnostic testing or medical management. 5. Develop an individualized treatment plan that appropriately balances therapeutic goals with identified risks, including modifications to exercise intensity, duration, and type. 6. Continuously monitor the patient for any adverse responses and adjust the treatment plan accordingly. Question 4. The analysis reveals that an orthopedic physical therapist is evaluating a patient with a history of recurrent ankle sprains and persistent gait instability. The therapist is considering how to best assess the patient's functional limitations. Which of the following approaches most comprehensively addresses the interplay of gravity, friction, and muscle forces in the context of the patient's gait and balance, aligning with the ethical and professional standards for a certified clinical specialist in orthopedic physical therapy in the United States? Option A. Recommending the immediate use of a rigid ankle brace and a cane to compensate for perceived instability, without a thorough assessment of how these devices alter the patient's interaction with gravitational and frictional forces. Option B. Focus on strengthening the intrinsic and extrinsic muscles of the foot and ankle, assuming that increased muscle force will inherently overcome any issues related to gravity or friction. Option C. Relying primarily on the patient's subjective report of feeling unstable, without performing objective measurements of gait parameters or muscle activation patterns. Option D. A detailed biomechanical analysis of the patient's gait, specifically examining how gravitational forces influence limb segment movement, how friction between the foot and the ground affects propulsion and stability, and the contribution and timing of specific muscle groups to counteract these forces and maintain balance. The correct answer is D. A detailed biomechanical analysis of the patient's gait, specifically examining how gravitational forces influence limb segment movement, how friction between the foot and the ground affects propulsion and stability, and the contribution and timing of specific muscle groups to counteract these forces and maintain balance. Explanation. This scenario is professionally challenging because it requires the orthopedic physical therapist to apply fundamental biomechanical principles to a patient's functional limitations, while adhering to the ethical and legal standards governing physical therapy practice in the United States, as defined by the American Physical Therapy Association (APTA), Standards of Practice, and the relevant state practice acts. The therapist must not only understand the forces at play, but also how to ethically and effectively assess and intervene based on that understanding, ensuring patient safety and optimal outcomes within the scope of practice. The correct approach involves a comprehensive assessment of how gravity, friction, and muscle forces interact to influence the patient's gait and balance, and then developing an intervention plan that addresses any deficits identified. This aligns with the APTA Code of Ethics, which mandates that physical therapists provide compassionate and ethical care, utilizing their professional judgment to make evidence-based decisions. Specifically, Principle 2A states that physical therapists shall act in the best interest of the patient at all times. By considering the interplay of these forces, the therapist is directly addressing the biomechanical factors contributing to the patient's functional limitations, which is a core competency for an OCS specialist. An incorrect approach that focuses solely on muscle strengthening without considering the influence of gravity and friction would be professionally deficient. This fails to acknowledge the complex biomechanical environment in which muscles operate. For instance, ignoring the effect of gravity on limb movement could lead to ineffective strengthening exercises or even exacerbate existing problems. Ethically, this approach could be seen as providing suboptimal care, not fully addressing the patient's needs as required by Principle 2A. Another incorrect approach that relies on patient self-report alone to determine the impact of these forces, without objective biomechanical assessment, is also problematic. While patient input is crucial, it cannot replace the therapist's clinical expertise in analyzing forces. This could lead to misdiagnosis or inappropriate treatment, potentially violating Principle 4E of the Code of Ethics, which states that physical therapists shall not engage in sexual, physical, emotional, or verbal abuse of any person. While not directly abuse, providing care based on incomplete assessment could be considered a failure to provide competent care. A further incorrect approach that involves prescribing assistive devices without a thorough understanding of how they modify the forces of gravity and friction during gait would be a failure of professional responsibility. Assistive devices are intended to alter the biomechanical forces to improve function and safety. Without this understanding, the therapist might select an inappropriate device, leading to increased fall risk or decreased functional mobility, which contradicts the mandate to act in the patient's best interest. The professional decision-making process for similar situations should involve a systematic approach. First, conducting a thorough subjective and objective examination, including a biomechanical analysis of the patient's movement. Second, identifying the specific forces, gravity, friction, muscle forces, that are contributing to the patient's impairments and functional limitations. Third, developing an evidence-based intervention plan that directly addresses these identified biomechanical factors. Fourth, continuously reassessing the patient's response to treatment and modifying the plan as needed, always prioritizing patient safety and optimal outcomes within the established ethical and legal framework of physical therapy practice in the United States. Question 5. Stakeholder feedback indicates a need to enhance patient understanding of the physiological basis of their orthopedic conditions. A patient undergoing rehabilitation for a rotator cuff tear asks, "What kind of muscle is the rotator cuff, and why does it get injured so easily?" Which of the following approaches best addresses this patient's inquiry within the scope of U.S. orthopedic physical therapy practice? Option A. Describe the rotator cuff as being similar to the smooth muscle found in the digestive system, highlighting its involuntary nature and constant activity. Option B. Provide a detailed lecture on the embryological development of all muscle tissue types, including their histological differences, without directly answering the patient's question about the rotator cuff. Option C. State that the rotator cuff is a complex tissue and that the specific type of muscle is not relevant to the rehabilitation process. Option D. Explain that the rotator cuff is composed of skeletal muscle, which is voluntary and responsible for movement, and that its susceptibility to injury relates to its role in dynamic stabilization and the forces it endures during overhead activities. The correct answer is D. Explain that the rotator cuff is composed of skeletal muscle, which is voluntary and responsible for movement, and that its susceptibility to injury relates to its role in dynamic stabilization and the forces it endures during overhead activities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the orthopedic physical therapist to integrate knowledge of basic science, muscle tissue types, with clinical application and patient education, all within the scope of practice defined by the relevant U.S. regulatory framework for physical therapy. The challenge lies in accurately and ethically conveying complex physiological information to a patient in a way that is understandable and relevant to their orthopedic condition, while also adhering to professional standards of care and communication. Correct approach analysis. The correct approach involves the physical therapist accurately identifying the muscle tissue type involved in the patient's condition and explaining its characteristics in a simplified, patient-centered manner. This aligns with the principle of providing evidence-based care and effective patient education, which are core tenets of the physical therapy profession as governed by state practice acts and APTA guidelines. Specifically, understanding that skeletal muscle is voluntary and responsible for movement is crucial for explaining the impact of orthopedic injuries on function and the rationale behind therapeutic interventions. This approach respects the patient's right to understand their condition and treatment plan. Incorrect approaches analysis. One incorrect approach involves the therapist incorrectly identifying the muscle tissue type or attributing characteristics of one type to another. This is a failure of clinical knowledge and can lead to misdiagnosis, inappropriate treatment, and patient confusion, violating the standard of care and potentially the principles of patient safety. Another incorrect approach is to provide overly technical or complex scientific jargon without simplification. This fails to meet the ethical obligation of clear and effective patient communication, hindering the patient's ability to participate in their care and make informed decisions. It also falls short of the professional responsibility to translate scientific knowledge into practical understanding for the patient. A third incorrect approach is to dismiss the patient's question or provide a vague, non-committal answer. This demonstrates a lack of engagement with the patient's learning needs and a failure to uphold the professional duty to educate and empower patients. It can erode patient trust and negatively impact adherence to treatment. Professional reasoning. Professionals should approach patient inquiries by first assessing the patient's current understanding and then providing clear, accurate, and relevant information tailored to their comprehension level. This involves active listening, using analogies where appropriate, and confirming understanding. When faced with a question about muscle tissue types in an orthopedic context, the therapist should recall that orthopedic conditions primarily affect skeletal muscle. The explanation should focus on the voluntary nature of skeletal muscle and its role in movement, relating it directly to the patient's functional limitations and the goals of physical therapy. This systematic approach ensures patient safety, promotes informed consent, and upholds the ethical standards of the profession. Question 6. Stakeholder feedback indicates a need for enhanced clinical reasoning skills in differentiating between various peripheral nerve entrapments of the upper extremity. A 45-year-old patient presents with progressive numbness and tingling in the thumb, index finger, and the radial half of the middle finger, accompanied by a subjective feeling of weakness in grip strength. The patient also reports occasional nocturnal paresthesias. Considering the specific anatomical distribution of sensory innervation and motor function in the upper extremity, which of the following diagnostic approaches would be most appropriate for an orthopedic physical therapist to initiate? Option A. Administer a standardized questionnaire for general upper extremity pain and disability without specific anatomical correlation. Option B. Systematically evaluate the sensory distribution of the median nerve, including the specific digits affected, and assess the motor function of muscles innervated by the median nerve, such as the thenar muscles, to identify potential signs of compression. Option C. Conduct a general assessment of all major muscle groups in the upper extremity for weakness and perform passive stretching of all joints to identify potential restrictions. Option D. Focus on assessing the range of motion and palpating for tenderness in the cervical spine, as neck pathology is a common cause of upper extremity symptoms. Correct answer is B. Systematically evaluate the sensory distribution of the median nerve, including the specific digits affected, and assess the motor function of muscles innervated by the median nerve, such as the thenar muscles, to identify potential signs of compression. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the orthopedic physical therapist to integrate advanced anatomical knowledge with clinical reasoning under the pressure of a time-sensitive situation. The therapist must accurately identify the affected nerve pathway to guide appropriate diagnostic and therapeutic interventions, while also considering the potential for misdiagnosis based on overlapping symptomology. The challenge lies in moving beyond superficial symptom presentation to a precise anatomical localization, which is critical for effective patient care and adherence to professional standards. Correct approach analysis. The correct approach involves systematically assessing the patient's symptoms and correlating them with the known anatomical distribution of peripheral nerves in the upper extremity, specifically focusing on the median nerve's sensory and motor components. This aligns with the core competencies of an orthopedic clinical specialist, which include advanced knowledge of musculoskeletal and neuromuscular anatomy. The justification for this approach is rooted in the principle of accurate diagnosis as the foundation for evidence-based practice, a cornerstone of physical therapy regulation and ethical practice. By identifying the specific nerve and its potential entrapment site, e.g., carpal tunnel, the therapist can then select the most appropriate and targeted interventions, thereby maximizing patient outcomes and adhering to the scope of practice. This methodical process ensures that interventions are not speculative, but are directly informed by a deep understanding of neuroanatomy and biomechanics. Incorrect approaches analysis. An approach that focuses solely on generalized upper extremity weakness without specific attention to the sensory distribution of the median nerve is ethically and professionally deficient. This failure to localize the deficit risks misdiagnosis, leading to ineffective or even detrimental treatment. It bypasses the specialized anatomical knowledge expected of an OCS and deviates from the regulatory requirement for evidence-based, targeted care. An approach that prioritizes treatment of the cervical spine without a thorough neurological examination of the upper extremity is also problematic. While cervical radiculopathy can mimic peripheral nerve entrapment, a failure to differentiate between the two based on specific nerve involvement, e.g., the distinct sensory pattern of median nerve compression versus a C6 or C7 radiculopathy, represents a significant lapse in diagnostic reasoning and anatomical application. This could lead to inappropriate interventions and delayed or misdiagnosis of the true underlying condition, violating the duty of care. An approach that relies on a broad differential diagnosis of all possible upper extremity pathologies without a structured, anatomically driven assessment is inefficient and potentially harmful. While differential diagnosis is important, it must be guided by a systematic evaluation of anatomical structures and their potential involvement. Without this anatomical framework, the therapist risks overlooking critical diagnostic clues and pursuing less effective treatment pathways, which is contrary to the professional obligation to provide precise and effective care. Professional reasoning. Professionals should employ a systematic, anatomy-driven approach to patient assessment. This involves 1. Eliciting a detailed history of symptoms, paying close attention to the quality, location, and aggravating/alleviating factors. 2. Performing a targeted physical examination that includes specific tests for nerve function, sensory and motor, palpation of potential entrapment sites, and assessment of related joints and structures. 3. Correlating findings with established anatomical pathways and known pathologies. 4. Developing a differential diagnosis that is prioritized based on the likelihood of anatomical involvement. 5. Formulating a treatment plan that directly addresses the identified anatomical dysfunction. This structured decision-making process ensures that interventions are evidence-based, patient-centered, and within the scope of specialized practice. Question 7. The performance metrics show a patient post-total knee arthroplasty exhibiting reduced peak knee flexion during the stance phase and increased peak hip abduction moment during the swing phase of gait. Which of the following interpretations best guides the subsequent physical therapy intervention plan? Option A. Recommend a period of rest and reduced weight bearing to allow the joint to recover from the observed gait abnormalities. Option B. Implement a program of stretching for the hip flexors and hamstrings to improve overall gait fluidity. Option C. Prioritize interventions aimed at improving quadricep strength and neuromuscular control to enhance knee flexion during stance, while simultaneously addressing hip abductor activation and motor control to mitigate the excessive hip abduction moment during swing. Option D. Focus solely on increasing the patient's walking speed to normalize the observed kinematic and kinetic deviations. The correct answer is C. Prioritize interventions aimed at improving quadricep strength and neuromuscular control to enhance knee flexion during stance, while simultaneously addressing hip abductor activation and motor control to mitigate the excessive hip abduction moment during swing. Explanation. The performance metrics show a patient presenting with altered gait kinematics and kinetics following a total knee arthroplasty. This scenario is professionally challenging because the orthopedic physical therapist must interpret complex biomechanical data to inform clinical decision-making, ensuring the patient's rehabilitation plan aligns with evidence-based practice and regulatory standards for patient care. The therapist must also consider the patient's subjective experience and functional goals within the context of objective kinematic and kinetic findings. The correct approach involves a comprehensive analysis of the kinematic and kinetic data in conjunction with the patient's functional limitations and goals, adhering to the American Physical Therapy Association (APTA) Standards of Practice for Physical Therapy and the Orthopaedic Clinical Specialist (OCS) certification's emphasis on advanced clinical reasoning. This approach ensures that interventions are evidence-based, patient-centered, and aimed at optimizing functional outcomes while minimizing the risk of re-injury or complications. Regulatory justification stems from the APTA Code of Ethics, which mandates providing competent and ethical care, and the OCS certification's requirement for advanced knowledge and skills in orthopedic physical therapy, including the application of biomechanical principles to gait analysis. An incorrect approach would be to solely focus on normalizing specific kinematic or kinetic parameters without considering the patient's overall functional capacity or pain levels. This fails to acknowledge that optimal gait may not always equate to a perfectly normal pattern, especially in the context of post-surgical recovery or chronic conditions. Ethically, this approach could lead to interventions that are overly aggressive or inappropriate for the individual, potentially causing harm or hindering progress, violating the APTA principle of beneficence. Another incorrect approach would be to disregard the kinematic and kinetic data entirely and rely solely on subjective patient reports. While patient feedback is crucial, ignoring objective biomechanical data can lead to missed opportunities for targeted interventions and a failure to identify underlying impairments contributing to functional deficits. This approach risks providing suboptimal care and may not meet the professional standards expected of an OCS specialist, potentially violating the APTA principle of professional integrity by not utilizing all available evidence to guide care. A third incorrect approach would be to apply generic gait retraining protocols without tailoring them to the specific kinematic and kinetic deviations identified in the patient's analysis. This lacks the individualized approach required for effective orthopedic rehabilitation and may not address the root causes of the patient's gait deviations. This failure to individualize care can be seen as a breach of professional responsibility to provide the highest quality of care, as expected by the OCS certification and APTA guidelines. The professional decision-making process should involve a systematic evaluation of the patient's presentation, including subjective reports, objective examination findings, and advanced biomechanical data such as kinematic and kinetic gait analysis. The therapist should then synthesize this information to develop a differential diagnosis of impairments, establish patient-centered goals, and formulate an evidence-based treatment plan that addresses the identified deficits while considering the patient's functional aspirations and the regulatory and ethical framework governing physical therapy practice. Question 8. Process analysis reveals a patient presenting with difficulty initiating abduction of the arm. To effectively design a rehabilitation program, a physical therapist must accurately identify the primary muscle responsible for this action, along with its origin, insertion, and innervation. Which of the following accurately describes the primary muscle involved in initiating arm abduction and its key anatomical and neurological details? Option A. Latissimus dorsi originates on the spinous processes of thoracic vertebrae, inserts on the floor of the bicipital groove of the humerus, and is innervated by the thoracodorsal nerve. Option B. Deltoid anterior fibers originates on the clavicle, inserts on the deltoid tuberosity of the humerus, and is innervated by the axillary nerve. Option C. Pectoralis major originates on the clavicle, sternum, and costal cartilages, inserts on the lateral lip of the bicipital groove of the humerus, and is innervated by the medial and lateral pectoral nerves. Option D. Supraspinatus originates on the supraspinous fossa of the scapula, inserts on the superior facet of the greater tubercle of the humerus, and is innervated by the suprascapular nerve. Correct answer is D. Supraspinatus originates on the supraspinous fossa of the scapula, inserts on the superior facet of the greater tubercle of the humerus, and is innervated by the suprascapular nerve. Explanation. This scenario is professionally challenging because it requires the orthopedic physical therapist to synthesize knowledge of muscle anatomy and biomechanics with the specific regulatory and ethical standards governing their practice within the United States, as defined by the American Physical Therapy Association, APTA, standards and relevant state practice acts. The therapist must accurately identify the primary actions of muscles involved in a complex movement, considering their origins, insertions, and innervation, to inform a safe and effective treatment plan. Misinterpreting muscle function can lead to inappropriate interventions, potentially causing harm or delaying recovery, which directly violates the ethical obligation to provide competent care and adhere to the scope of practice. The correct approach involves a thorough and accurate identification of the origin, insertion, and primary actions of the muscles involved in the described movement, considering their innervation. This is crucial for developing a targeted and evidence-based treatment plan. For example, understanding that the supraspinatus originates on the supraspinous fossa of the scapula, inserts on the superior facet of the greater tubercle of the humerus, and is primarily responsible for initiating abduction of the arm, innervated by the suprascapular nerve, allows the therapist to design exercises that specifically address potential deficits in this muscle's function. This aligns with the APTA Code of Ethics, which mandates that physical therapists provide safe and effective care based on their knowledge and expertise. Furthermore, state practice acts define the scope of physical therapy practice, and accurate anatomical and physiological knowledge is foundational to operating within that scope. An incorrect approach that focuses solely on the gross movement, without detailing the specific muscle contributions and their anatomical landmarks, fails to provide the necessary specificity for effective intervention. This could lead to generalized exercises that do not address the root cause of dysfunction, potentially delaying patient progress and violating the principle of providing individualized care. Another incorrect approach that misidentifies the origin or insertion of a key muscle would lead to an inaccurate understanding of its biomechanical role. For instance, confusing the origin and insertion of the deltoid muscle would fundamentally alter the therapist's understanding of its actions, leading to the prescription of exercises that are biomechanically unsound or ineffective for the intended outcome. This demonstrates a lack of fundamental knowledge, which is a violation of the duty of care. An approach that neglects to consider the innervation of the muscles is also flawed. Understanding the nerve supply is critical for identifying potential neurological components of dysfunction and for designing interventions that are safe for patients with compromised neural pathways. For example, if a patient has a suspected suprascapular nerve palsy, an intervention that heavily relies on supraspinatus activation without considering this innervation could be detrimental. This oversight would represent a failure to provide comprehensive and safe care. The professional reasoning process for similar situations should involve a systematic review of the patient's presentation, a detailed anatomical and biomechanical analysis of the affected region, and the application of evidence-based practice principles. This includes consulting reliable anatomical resources, considering the patient's specific pathology, and formulating a treatment plan that is both effective and safe, always within the established scope of physical therapy practice as defined by the APTA and relevant state laws. Question 9. Consider a scenario where a physical therapist is evaluating a patient presenting with pain and limited mobility in the wrist. The therapist palpates a small, rounded bone embedded within a tendon. Based on its location and morphology, the therapist needs to accurately classify this bone to inform their treatment plan for the patient's wrist condition. Which of the following classifications best describes this type of bone? Option A, long bone. Option B, sesamoid bone. Option C, irregular bone. Option D, short bone. The correct answer is B, sesamoid bone. Explanation. The scenario presents a professional challenge due to the need for accurate bone classification in the context of orthopedic physical therapy, which directly impacts diagnosis, treatment planning, and patient education. Misclassification can lead to inappropriate interventions, delayed recovery, and potential harm. The Certified Clinical Specialist in Orthopedic Physical Therapy, OCS, designation implies a commitment to upholding the highest standards of practice, which includes a thorough understanding of anatomical structures and their functional implications. Adherence to the regulatory framework, laws, and guidelines for the OCS exam is paramount, ensuring that practice is evidence-based and ethically sound. The correct approach involves accurately identifying the bone's structural characteristics and classifying it according to established anatomical categories: long, short, flat, irregular, sesamoid. This classification is not merely academic. It informs the physical therapist's understanding of the bone's biomechanical role, its typical injury patterns, and the most effective rehabilitation strategies. For instance, understanding that a long bone's primary function is leverage and support, while a short bone's is stability and shock absorption, guides the selection of exercises and manual techniques. This aligns with the OCS credential's emphasis on specialized knowledge and its application to patient care, ensuring that interventions are tailored to the specific anatomical context and the patient's condition, thereby upholding professional responsibility and patient safety. An incorrect approach would be to rely on superficial visual assessment without considering the underlying structural and functional characteristics. This could lead to misclassification, such as labeling a bone as short when its primary role is leverage, or vice versa. Such a failure to apply precise anatomical knowledge violates the OCS standard of specialized expertise and can result in the implementation of inappropriate therapeutic interventions. Another incorrect approach would be to generalize treatment strategies across different bone types without considering their unique biomechanical properties. This demonstrates a lack of deep understanding of orthopedic principles and can lead to suboptimal outcomes or even exacerbate existing conditions, failing to meet the ethical obligation to provide competent and evidence-based care. The professional decision-making process in such situations requires a systematic approach. First, a thorough anatomical assessment, including palpation and consideration of the bone's location and function within the skeletal system. Second, applying the established classification criteria for long, short, flat, irregular, and sesamoid bones. Third, integrating this classification with the patient's specific clinical presentation and functional goals to develop a targeted and effective treatment plan. This process ensures that clinical reasoning is grounded in accurate anatomical knowledge and adheres to the professional standards expected of an OCS. Question 10. Governance review demonstrates a pattern of patient complaints regarding persistent, localized pain in the posterior shoulder region following a fall. The physical therapist, an OCS specialist, notes the patient reports pain with overhead reaching and external rotation. While the patient points to the general area of the infraspinatus, the therapist is considering the possibility of referred pain from the trapezius or a primary issue with the deltoid. Which of the following approaches best reflects the OCS specialist's responsibility to apply specific muscle anatomy knowledge in this diagnostic process? Option A. Focus treatment on general shoulder strengthening exercises for the entire shoulder girdle to address the patient's reported pain location. Option B. Prioritize exercises that directly address the deltoid muscle's role in abduction, as overhead reaching is a primary complaint. Option C. Assume the pain is originating from the trapezius muscle due to its proximity to the posterior shoulder and initiate treatment for upper trapezius tightness. Option D. Systematically assess the integrity and function of the infraspinatus, teres minor, and posterior deltoid muscles, considering their origins, insertions, and biomechanical roles in external rotation and abduction, to pinpoint the source of pain. The correct answer is D. Systematically assess the integrity and function of the infraspinatus, teres minor, and posterior deltoid muscles, considering their origins, insertions, and biomechanical roles in external rotation and abduction, to pinpoint the source of pain. Explanation. This scenario presents a professional challenge due to the potential for misdiagnosis and inappropriate treatment stemming from incomplete or inaccurate anatomical knowledge. The Certified Clinical Specialist in Orthopedic Physical Therapy, OCS, designation signifies a high level of expertise, and adherence to established anatomical knowledge is fundamental to safe and effective patient care. The challenge lies in balancing the need for timely intervention with the imperative of precise anatomical understanding, particularly when faced with complex presentations. The correct approach involves a thorough and systematic assessment of the patient's symptoms, correlating them with a precise understanding of the relevant musculature of the upper extremity, including the rotator cuff, deltoid, biceps, and triceps, as well as the intrinsic hand muscles. This requires recalling and applying detailed anatomical knowledge of muscle origins, insertions, innervations, and biomechanical functions to differentiate between potential pathologies. For instance, distinguishing between supraspinatus tendinopathy and infraspinatus strain requires a nuanced understanding of their respective roles in abduction and external rotation. This meticulous anatomical correlation is directly supported by the foundational principles of physical therapy practice and the OCS certification's emphasis on advanced clinical reasoning grounded in anatomical science. An incorrect approach would be to rely on superficial symptom presentation without a deep dive into the underlying anatomy. For example, assuming shoulder pain is solely a deltoid issue without considering the intricate interplay of the rotator cuff muscles would be a significant anatomical oversight. This failure to precisely identify the involved musculature based on its specific anatomical location and function could lead to the selection of inappropriate therapeutic exercises or modalities, potentially exacerbating the condition or delaying effective treatment. Such an approach violates the ethical obligation to provide competent care and the professional standard expected of an OCS specialist, which mandates a comprehensive understanding of musculoskeletal anatomy. Another incorrect approach would be to generalize the problem to a broader region without specific muscle identification. For instance, attributing all elbow pain to forearm muscles without differentiating between the flexor and extensor muscle groups or their specific origins from the medial and lateral epicondyles, respectively, demonstrates a lack of the detailed anatomical knowledge required for accurate diagnosis and targeted intervention. This broad generalization bypasses the critical step of precise anatomical localization, which is essential for developing an effective treatment plan. A further incorrect approach would be to prioritize patient-reported pain location over objective anatomical findings. While patient reports are crucial, they must be interpreted through the lens of anatomical knowledge. For example, if a patient reports pain in the posterior shoulder, but the objective examination and anatomical understanding point towards the teres minor or infraspinatus, focusing solely on the superficial pain description without considering the specific muscle anatomy involved, would be a flawed diagnostic process. This neglects the OCS specialist's responsibility to integrate subjective and objective findings with a robust anatomical framework. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and document the patient's subjective complaints. Second, conduct a comprehensive objective examination, including palpation, range of motion, strength testing, and special tests, always correlating findings with specific anatomical structures. Third, utilize advanced anatomical knowledge to formulate a differential diagnosis, prioritizing the most likely involved muscles and their pathologies. Fourth, develop a treatment plan that is directly targeted at the identified anatomical dysfunction. Finally, continuously reassess the patient's response to treatment, refining the diagnosis and plan as needed, always grounded in precise anatomical understanding. Question 11. The control framework reveals that an orthopedic physical therapist specializing in joint reaction forces has a patient presenting with chronic knee osteoarthritis. The therapist has assessed the patient's gait and functional movements, identifying specific activities that appear to exacerbate joint loading and pain. The therapist is considering how to best integrate their advanced understanding of joint reaction forces into the patient's management plan. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for an OCS certified physical therapist? Option A. Provide the patient with a general handout on osteoarthritis and suggest they consult with their orthopedic surgeon for guidance on managing joint reaction forces. Option B. Educate the patient on how specific movement patterns and activity choices influence the forces acting across the knee joint, and collaboratively develop strategies for activity modification and exercise selection to minimize excessive joint loading while promoting functional mobility. Option C. Advise the patient to avoid all high-impact activities and recommend a specific brand of knee brace that has shown some anecdotal success in reducing joint pain without further biomechanical analysis. Option D. Interpret the patient's gait analysis findings as definitive evidence of a need for surgical intervention and communicate this recommendation directly to the patient. The correct answer is B. Educate the patient on how specific movement patterns and activity choices influence the forces acting across the knee joint, and collaboratively develop strategies for activity modification and exercise selection to minimize excessive joint loading while promoting functional mobility. Explanation. This scenario presents a professional challenge because it requires the orthopedic physical therapist to integrate complex biomechanical principles, joint reaction forces, with the practical realities of patient care and the established scope of practice as defined by the regulatory framework governing the Certified Clinical Specialist in Orthopedic Physical Therapy (OCS) credential. The challenge lies in translating theoretical knowledge of joint loading into actionable clinical decisions that are both evidence-based and ethically sound, ensuring patient safety and optimal outcomes within the defined professional boundaries. Careful judgment is required to avoid overstepping the scope of practice or making recommendations that are not supported by the current evidence or regulatory guidelines. The correct approach involves the physical therapist utilizing their advanced knowledge of joint reaction forces to inform their clinical reasoning and patient education regarding activity modification and exercise selection. This approach is justified by the OCS credential's emphasis on specialized knowledge and application in orthopedic physical therapy. Regulatory frameworks for physical therapy, including those implicitly guiding OCS certification, mandate that practitioners operate within their scope of practice, which includes the application of biomechanical principles to guide treatment and patient instruction. Educating patients about how specific movements or activities influence joint loading, and consequently their pain and function, is a core competency. This empowers patients to make informed decisions about their participation in activities and adherence to therapeutic regimens, directly contributing to improved management of their orthopedic condition. An incorrect approach would be to provide definitive prognoses or prescribe specific medical interventions that fall outside the scope of physical therapy practice, such as recommending surgical interventions or interpreting diagnostic imaging findings beyond what is standard for physical therapists. This is a regulatory and ethical failure because it constitutes practicing medicine without a license or exceeding the defined scope of practice for physical therapists. Such actions could lead to patient harm, misdiagnosis, and legal repercussions for the therapist and the profession. Another incorrect approach would be to dismiss the concept of joint reaction forces as overly theoretical and irrelevant to clinical practice, opting instead for a purely symptom-based treatment approach without considering the underlying biomechanical contributors. This represents a failure to leverage advanced knowledge and skills that are central to the OCS specialization. It neglects the opportunity to provide a more comprehensive and potentially more effective treatment plan that addresses the root causes of joint stress and pain, thereby failing to meet the expected standard of care for an orthopedic specialist. A further incorrect approach would be to provide generalized advice about joint loading without tailoring it to the individual patient's specific condition, activity level, and functional goals. This lacks the specificity and personalization required for effective orthopedic physical therapy and could lead to inappropriate activity modifications or exercise prescriptions. It fails to meet the ethical obligation to provide individualized care based on a thorough assessment and understanding of the patient's unique biomechanical profile and functional needs. A professional decision-making process for similar situations should involve a systematic evaluation of the patient's condition through the lens of advanced orthopedic principles, including biomechanics. The therapist must then consider how this knowledge can be practically applied to inform treatment planning, patient education, and collaboration with other healthcare professionals. A critical step is to always remain within the defined scope of practice and ethical guidelines, ensuring that all interventions and recommendations are evidence-based, patient-centered, and legally permissible. When in doubt, consultation with peers or supervisors or referral to another healthcare professional is the appropriate course of action. Question 12. Operational review demonstrates a patient presenting with insidious onset of deep, aching knee pain, exacerbated by prolonged sitting and stair climbing, with a palpable crepitus during passive knee flexion and extension. The patient reports occasional mild swelling. The physical therapist's initial assessment notes generalized quadriceps weakness and mild hamstring tightness. Which of the following approaches best reflects the OCS specialist's responsibility in addressing the potential underlying joint structure pathology? Option A. Initiate a progressive strengthening program for the quadriceps and hamstrings, incorporating stretching for the hamstrings to address the noted muscle imbalances. Option B. Prescribe modalities such as ultrasound and electrical stimulation to manage the patient's pain and reduce swelling. Option C. Focus on improving gait mechanics and weight-bearing tolerance through functional training exercises, assuming the pain is primarily biomechanical. Option D. Conduct a detailed assessment of articular cartilage integrity, synovial membrane inflammation, and ligamentous stability through specific joint play assessment, palpation for effusion, and targeted ligamentous stress tests. The correct answer is A. Initiate a progressive strengthening program for the quadriceps and hamstrings, incorporating stretching for the hamstrings, to address the noted muscle imbalances. Explanation. This scenario presents a professional challenge rooted in the nuanced application of orthopedic physical therapy principles within the specific regulatory framework governing the Certified Clinical Specialist in Orthopedic Physical Therapy (OCS) credential. The challenge lies in accurately assessing and intervening in a patient's condition where the underlying pathology directly impacts the structural integrity of joint components, requiring a deep understanding of their function and potential dysfunctions. Careful judgment is required to differentiate between primary structural issues and secondary compensatory mechanisms, ensuring that the chosen intervention is both evidence-based and aligned with the scope of practice for an OCS specialist. The correct approach involves a comprehensive evaluation that meticulously assesses the integrity and function of the joint capsule, ligaments, articular cartilage, and synovial membrane. This includes a thorough subjective history, objective examination focusing on range of motion, joint play, palpation, special tests for ligamentous integrity, and assessment of joint effusion or crepitus indicative of synovial membrane or cartilage pathology. The rationale for this approach is grounded in the OCS certification's emphasis on advanced clinical reasoning and the application of specialized knowledge in orthopedic conditions. Regulatory and ethical guidelines for OCS specialists mandate a thorough diagnostic process that identifies the root cause of dysfunction to guide effective treatment. This systematic evaluation ensures that interventions are targeted to address the specific structural deficits, promoting optimal healing and functional recovery, thereby upholding the professional standards and patient care expectations associated with the OCS credential. An incorrect approach that focuses solely on muscle strength deficits without adequately assessing the underlying joint structure would be professionally unacceptable. This failure stems from a lack of comprehensive evaluation, potentially leading to ineffective or even detrimental treatment. Such an approach neglects the fundamental principles of orthopedic physical therapy, which require understanding the biomechanical relationships between soft tissues and joint stability. Ethically, it violates the principle of beneficence by not providing the most appropriate and effective care. Another incorrect approach that relies on generalized manual therapy techniques without a clear hypothesis regarding the specific joint structure being addressed is also professionally flawed. While manual therapy can be beneficial, its application must be guided by a precise understanding of the underlying pathology. Without this, interventions may be applied indiscriminately, failing to address the specific structural impairments of the capsule, ligaments, cartilage, or synovial membrane. This represents a departure from evidence-based practice and the specialized knowledge expected of an OCS specialist, potentially leading to patient dissatisfaction and suboptimal outcomes. A further incorrect approach that prioritizes pain reduction through modalities alone, without a thorough assessment of the structural contributions to the pain, is also ethically and professionally deficient. While pain management is a crucial aspect of physical therapy, it should not supersede the identification and treatment of the underlying structural pathology. This approach fails to address the root cause of the patient's condition, potentially masking symptoms, while the underlying structural issues persist or worsen, thus violating the duty of care. The professional decision-making process for similar situations should involve a systematic, hypothesis-driven evaluation. This begins with a detailed subjective history to gather clues about the onset, nature, and aggravating/easing factors of the patient's symptoms, which can often point towards specific joint structures. This is followed by a targeted objective examination, employing a battery of tests and measures designed to isolate and assess the integrity and function of the joint capsule, ligaments, cartilage, and synovial membrane. The findings from both subjective and objective assessments are then synthesized to form a clinical impression, guiding the selection of evidence-based interventions that directly address the identified structural impairments. Continuous reassessment throughout the treatment course is crucial to monitor progress and adjust the treatment plan as needed, ensuring adherence to the highest standards of orthopedic physical therapy practice. Question 13. The audit findings indicate a need to better articulate the relationship between joint limitations and functional deficits in patient documentation. Considering a patient presenting with significant pain and restricted range of motion in the shoulder, which of the following best describes the underlying joint classification and its direct implication for functional limitations, as would be expected in OCS-level documentation? Option A. The shoulder is an amphiarthrotic joint, and its slight mobility explains the patient's difficulty with fine motor skills. Option B. The shoulder is a synarthrotic joint, and its limited movement contributes to functional deficits in daily tasks. Option C. The shoulder is a diarthrotic joint, and its inherent mobility allows for a wide arc of motion. Restrictions in this diarthrotic joint directly translate to functional limitations in activities requiring overhead reaching, lifting, and throwing. Option D. The shoulder is a diarthrotic joint, and its primary function is to provide structural support, leading to functional limitations in weight-bearing activities. The correct answer is C. The shoulder is a diarthrotic joint, and its inherent mobility allows for a wide arc of motion. Restrictions in this diarthrotic joint directly translate to functional limitations in activities requiring overhead reaching, lifting, and throwing. Explanation. This scenario presents a professional challenge because it requires the orthopedic physical therapist to reconcile audit findings, which are often focused on documentation and billing compliance, with the core clinical understanding of joint classification. The audits focus on the functional impact of joint limitations rather than the anatomical or biomechanical classification of the joint itself, creates a potential disconnect. The therapist must demonstrate a nuanced understanding of how joint structure dictates potential movement and therefore functional limitations, while also adhering to the specific documentation and reporting requirements highlighted by the audit. Careful judgment is required to ensure that the clinical reasoning aligns with both best practice in orthopedic physical therapy and the regulatory expectations of the audit. The correct approach involves accurately classifying the joint based on its structural and functional characteristics as defined in orthopedic physical therapy principles, and then articulating how impairments within that specific joint type lead to the observed functional limitations. This aligns with the OCS certification's emphasis on deep clinical knowledge and its application. Specifically, understanding that a diarthrotic joint, by its nature, allows for a wide range of motion, and therefore limitations in this type of joint will manifest as restrictions in mobility, strength, or pain during functional activities, is crucial. This approach is ethically and regulatorily sound, as it demonstrates competent clinical reasoning and accurate patient assessment, which are foundational to providing effective and safe physical therapy. An incorrect approach would be to solely focus on the functional limitations without referencing the underlying joint classification. This fails to demonstrate the specialized knowledge expected of an OCS and may lead to documentation that is vague or does not fully capture the biomechanical basis of the patient's condition. It also risks misinterpreting the audit's intent, potentially leading to an incomplete or inaccurate response. Another incorrect approach would be to misclassify the joint type. For example, describing a diarthrotic joint as synarthrotic would fundamentally misunderstand the joint's structure and potential for movement, leading to flawed clinical reasoning and potentially inappropriate treatment planning. This represents a significant failure in core orthopedic knowledge and would be a direct violation of professional standards and the principles underlying the OCS certification. A further incorrect approach would be to overemphasize the audit's focus on functional impact to the exclusion of anatomical and biomechanical principles. While functional impact is important, it must be grounded in an understanding of the joint's inherent characteristics. Focusing solely on functional outcomes without linking them to the specific joint classification would be a superficial response that does not reflect the depth of expertise required for OCS certification. The professional reasoning process for similar situations should involve 1. Thoroughly understanding the audit's findings and their specific requirements. 2. Recalling and applying core orthopedic physical therapy principles, including joint classification. 3. Synthesizing the audit's requirements with clinical knowledge to provide a response that is both compliant and clinically sound. 4. Ensuring that all documentation and communication accurately reflect the patient's condition and the therapist's expertise. Question 14. Market research demonstrates a growing interest in novel therapeutic modalities for enhancing muscle healing following orthopedic injuries. A physical therapist specializing in orthopedic physical therapy is tasked with developing a treatment protocol for a patient with a significant hamstring tear. The therapist must decide whether to prioritize interventions based on early-stage, promising but not yet widely validated research, or to focus on established, evidence-backed modalities with a long track record of efficacy. Which of the following approaches best reflects the OCS-certified specialist's responsibility in this situation? Option A. Conduct a comprehensive systematic review and meta-analysis of all available research on muscle healing, prioritizing interventions with the highest level of evidence and demonstrating consistent positive outcomes across multiple studies, while also considering the patient's individual presentation and goals. Option B. Rely on personal clinical experience and anecdotal reports from colleagues regarding the effectiveness of various muscle healing techniques without consulting peer-reviewed literature. Option C. Implement a treatment protocol based on a single, highly publicized case study that shows dramatic improvement, disregarding the need for broader scientific validation or comparative analysis. Option D. Solely adopt the newest, most technologically advanced therapeutic modality advertised for muscle healing, assuming it represents the cutting edge of treatment and will yield superior results. The correct answer is A. Conduct a comprehensive systematic review and meta-analysis of all available research on muscle healing, prioritizing interventions with the highest level of evidence and demonstrating consistent positive outcomes across multiple studies, while also considering the patient's individual presentation and goals. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the orthopedic physical therapist to critically evaluate and compare different evidence-based approaches to muscle healing, considering the nuances of each. The challenge lies in discerning which approach is most appropriate given the current state of research and the specific needs of the patient, while adhering to the professional standards and ethical guidelines governing the practice of physical therapy in the United States, as mandated by the OCS certification framework. This necessitates a deep understanding of the underlying physiological processes of muscle repair and regeneration, as well as the ability to translate this knowledge into clinical decision-making. Correct approach analysis. The correct approach involves a comprehensive review of current literature on muscle healing, focusing on comparative studies that evaluate the efficacy of different interventions. This approach is justified by the OCS certification's emphasis on evidence-based practice and the ethical obligation to provide the highest standard of care. By synthesizing findings from high-quality research, the therapist can identify interventions with the strongest evidence base for promoting optimal muscle healing, considering factors such as the type and severity of injury, patient characteristics, and functional goals. This aligns with the principles of professional competence and patient advocacy, ensuring that treatment decisions are informed by the best available scientific knowledge. Incorrect approach is analysis, an approach that relies solely on anecdotal evidence or personal experience, without seeking out or critically appraising current research, is ethically flawed. This fails to uphold the standard of care expected of a certified specialist and could lead to suboptimal patient outcomes. It disregards the principle of evidence-based practice, which is a cornerstone of professional physical therapy. An approach that prioritizes a single, unproven therapeutic modality without considering its comparative effectiveness against other established treatments is also problematic. This could be driven by marketing hype rather than scientific validation, leading to inefficient or ineffective care. It violates the ethical duty to use resources wisely and to provide treatments that are demonstrably beneficial. An approach that dismisses emerging research findings that challenge established practices without a thorough critical evaluation is a failure of professional due diligence. This can lead to stagnation in practice and prevent patients from benefiting from advancements in the field. It demonstrates a lack of commitment to lifelong learning and professional development, which are essential for maintaining specialist-level competence. Professional reasoning. Professionals should adopt a systematic approach to evaluating treatment options for muscle healing. This involves 1. Identifying the specific clinical question, 2. Conducting a thorough literature search using reputable databases, 3. Critically appraising the quality and relevance of the retrieved studies, 4. Synthesizing the evidence to identify the most effective interventions, and 5. Integrating this evidence with patient values and clinical expertise to make informed treatment decisions. This process ensures that practice is grounded in scientific evidence and ethical principles. Question 15. Compliance review shows that a physical therapist is evaluating a patient 12 months post-ACL reconstruction. The patient reports persistent anterior knee pain during functional activities like squatting and stair negotiation, despite completing a standard rehabilitation program. Objective data from a functional movement assessment reveals increased knee valgus collapse during a single-leg squat, reduced peak hip abduction torque, and a slightly delayed onset of gluteus medius activation during gait. The therapist is tasked with interpreting this biomechanical data to guide the next steps in the patient's rehabilitation. Which of the following approaches best reflects the appropriate clinical reasoning process for this situation? Option A. Conclude that the persistent pain and observed biomechanical deviations indicate a need for further surgical intervention, and refer the patient back to the orthopedic surgeon without further physical therapy assessment. Option B. Integrate the kinematic and kinetic data with the patient's subjective complaints and observed functional deficits to identify underlying biomechanical impairments, and then develop a targeted treatment plan to address these impairments and improve dynamic knee stability. Option C. Prioritize the patient's subjective reports of pain and functional limitations, disregarding the objective biomechanical data as it may be influenced by factors beyond the therapist's control. Option D. Focus on the numerical values of the kinematic and kinetic data, identifying any deviations from normative values and prescribing exercises solely to correct these specific numerical discrepancies. The correct answer is D. Focus on the numerical values of the kinematic and kinetic data, identifying any deviations from normative values and prescribing exercises solely to correct these specific numerical discrepancies. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic physical therapy, interpreting complex biomechanical data to inform clinical decision-making for a patient with a history of anterior cruciate ligament (ACL) reconstruction. The challenge lies in translating objective kinematic and kinetic measurements into a meaningful clinical picture that guides safe and effective rehabilitation. The physical therapist must synthesize data from multiple sources, Understand the implications of deviations from normal biomechanics, and apply this knowledge within the scope of practice and ethical guidelines. The pressure to provide evidence-based care, coupled with the potential for misinterpretation of data, necessitates a rigorous and systematic approach. Correct approach analysis. The correct approach involves a comprehensive interpretation of the provided kinematic and kinetic data in the context of the patient's specific functional deficits and rehabilitation goals. This includes identifying deviations from normative biomechanical patterns during functional tasks, e.g., gait, squatting, and correlating these deviations with the patient's subjective complaints and objective findings. For instance, observing increased knee valgus during a squat, coupled with reduced quadriceps activation and reported anterior knee pain, would strongly suggest a biomechanical issue related to altered joint loading and muscle control. The therapist would then use this understanding to modify the treatment plan, focusing on neuromuscular reeducation, strengthening of key stabilizing muscles, e.g., gluteals, quadriceps, and proprioceptive training to improve dynamic knee stability and reduce aberrant joint forces. This approach aligns with the core principles of evidence-based practice, which mandate the integration of the best available research evidence with clinical expertise and patient values. Specifically, the American Physical Therapy Association, APTA, Standards of Practice for Physical Therapy, and the Code of Ethics for Physical Therapists emphasize the therapist's responsibility to provide competent care, which includes the accurate assessment and management of musculoskeletal impairments based on sound biomechanical principles. Incorrect approaches analysis. One incorrect approach would be to solely focus on the numerical values of the kinematic and kinetic data, without considering their functional implications or the patient's subjective experience. For example, if the data shows a slight deviation in peak knee flexion during a squat, but the patient reports no pain and demonstrates good functional performance, overtreating based solely on the numerical anomaly would be inappropriate. This fails to adhere to the principle of patient-centered care and may lead to unnecessary interventions. Another incorrect approach would be to disregard the biomechanical data entirely and rely solely on subjective reports and gross observation. While subjective feedback is crucial, ignoring objective kinematic and kinetic data, especially in a post-operative ACL reconstruction patient, would be a failure to utilize all available diagnostic tools. This could lead to missed opportunities for identifying subtle but significant biomechanical impairments that contribute to pain or functional limitations, thereby violating the standard of care for managing complex orthopedic conditions. A third incorrect approach would be to make definitive pronouncements about the patient's prognosis or the necessity of further surgical intervention based solely on the biomechanical data, without considering the full clinical picture, including the patient's response to conservative management and other contributing factors. This oversteps the scope of physical therapy practice and could lead to inappropriate patient management decisions. Professional reasoning. Professionals should approach such scenarios by first establishing a clear understanding of the patient's history, current complaints, and functional goals. Next, they should systematically analyze the provided biomechanical data, correlating kinematic and kinetic findings with observed functional deficits and subjective reports. This analysis should then inform the development or modification of a treatment plan that directly addresses the identified biomechanical impairments through targeted interventions. Regular reassessment of the patient's response to treatment and reevaluation of the biomechanical data are essential to ensure the effectiveness and appropriateness of the ongoing care. This iterative process, grounded in evidence-based practice and ethical considerations, ensures that interventions are both clinically sound and patient-centered. Question 16. Cost-benefit analysis shows that addressing a patient's difficulty in smoothly initiating and controlling the speed of their leg movements during walking and sit-to-stand transfers, which are indicative of impaired linear motion control, velocity, and acceleration, is crucial for their functional independence and fall prevention. A physical therapist is evaluating this patient. Which of the following approaches best aligns with the principles of advanced orthopedic physical therapy practice and regulatory expectations for skilled intervention in the United States? Option A. Implement a treatment plan focusing on improving quadriceps strength and range of motion of the hip and knee, assuming these are the primary drivers of functional limitations. Option B. Focus on proprioception exercises in isolation, without directly addressing the patient's reported difficulties with movement initiation and termination speed. Option C. Recommend assistive devices such as a walker for all transfers and ambulation, without further assessment of the patient's underlying motor control deficits. Option D. Conduct a detailed analysis of the patient's ability to control the rate of change of displacement, acceleration and deceleration during functional movements, and design interventions to improve this control, documenting the skilled nature of the assessment and treatment. The correct answer is A. Implement a treatment plan focusing on improving quadriceps strength and range of motion of the hip and knee, assuming these are the primary drivers of functional limitations. Explanation. The scenario presents a common challenge in orthopedic physical therapy, where a patient's functional limitations are directly related to their ability to control linear motion, specifically in the context of gait and transfers. The challenge lies in accurately assessing and intervening for subtle deficits in velocity and acceleration control, which can significantly impact safety and independence, and in justifying the chosen intervention based on evidence and patient-centered goals. The OCS certification emphasizes advanced clinical reasoning and evidence-based practice within the U.S. regulatory framework governing physical therapy. The correct approach involves a comprehensive assessment of the patient's linear motion capabilities during functional tasks, identifying specific deficits in their ability to initiate, control, and terminate movements, displacement, velocity, and acceleration. This assessment should inform a targeted intervention plan that addresses these deficits through appropriate therapeutic exercises and strategies, aligning with the APTA standards of practice and code of ethics, which mandate evidence-based care and patient autonomy. The justification for interventions must be rooted in the patient's functional goals and the expected impact on their quality of life, as well as adherence to Medicare guidelines for skilled physical therapy services. An incorrect approach would be to focus solely on gross range of motion or strength without considering the dynamic control of movement. This fails to address the underlying biomechanical impairments affecting linear motion and may lead to ineffective or incomplete rehabilitation. Another incorrect approach would be to implement interventions without a clear rationale linked to the patient's specific deficits in velocity or acceleration control, or without documenting the skilled nature of the intervention, potentially violating Medicare requirements for reimbursement and the ethical obligation to provide appropriate care. Third incorrect approach would be to dismiss the patient's subjective reports of instability or difficulty with movement initiation/termination, as these often directly correlate with impaired control of linear motion and require skilled physical therapist evaluation and intervention. Professionals should employ a decision-making framework that begins with a thorough subjective and objective examination, specifically probing for difficulties with movement initiation, control, and termination. This should be followed by a functional assessment that quantizes or qualitatively describes deficits in linear motion parameters during relevant activities. The therapist then synthesizes this information to formulate a differential diagnosis and a patient-centered treatment plan, selecting interventions that are evidence-based and directly address the identified impairments in displacement, velocity, and acceleration. Ongoing reassessment and outcome measurement are crucial to demonstrate the skilled nature of the intervention and its effectiveness, ensuring compliance with regulatory requirements and ethical standards. Question 17. Benchmark analysis indicates that a patient presents with increasing localized pain, warmth, and erythema around a surgically repaired tibial fracture site, approximately 3 weeks post-operatively. The patient also reports a low-grade fever and general malaise. The physical therapist is tasked with developing a rehabilitation plan. Which of the following approaches best reflects the OCS specialist's responsibility in this scenario? Option A. Immediately consult with the orthopedic surgeon to discuss the possibility of osteomyelitis, providing a summary of clinical findings and requesting further diagnostic workup. Option B. Focus solely on functional mobility and gait training, considering the pain and warmth as expected limitations for this stage of recovery. Option C. Initiate a progressive strengthening and range of motion program, assuming the symptoms are a normal inflammatory response to surgery and fracture healing. Option D. Advise the patient to rest and apply ice to the affected area, deferring any active rehabilitation until symptoms completely resolve. Correct answer is C. Initiate a progressive strengthening and range of motion program, assuming the symptoms are a normal inflammatory response to surgery and fracture healing. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a physical therapist must differentiate between a patient's acute presentation of osteomyelitis and a postoperative inflammatory response following orthopedic surgery for a fracture. Both conditions can manifest with similar symptoms such as pain, swelling, warmth, and limited range of motion. Misdiagnosis can lead to delayed or inappropriate treatment, potentially resulting in severe complications like chronic infection, bone destruction, or implant failure, significantly impacting patient outcomes and increasing healthcare costs. The OCS specialist's role demands a high level of diagnostic acumen and the ability to integrate clinical findings with diagnostic imaging and laboratory data within the established scope of practice. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the patient's history, physical examination findings, and review of diagnostic imaging and laboratory results. This systematic process allows for the differential diagnosis of osteomyelitis versus postoperative inflammation. Specifically, the OCS specialist should look for red flags indicative of infection, such as persistent fever, elevated white blood cell count, elevated C-reactive protein, and specific findings on imaging e.g. periosteal reaction, bone destruction, fluid collections. This approach aligns with the ethical responsibility to provide competent and evidence-based care, ensuring patient safety and optimal treatment planning. The American Physical Therapy Association, APTA, Standards of Practice and the OCS Examination Blueprint emphasize the importance of differential diagnosis and the integration of diagnostic information in orthopedic physical therapy. Incorrect approaches analysis. One incorrect approach would be to solely rely on the patient's subjective report of pain and swelling without a thorough, objective examination or review of diagnostic data. This fails to acknowledge the potential for serious underlying pathology and neglects the physical therapist's responsibility to gather comprehensive information. It also bypasses the critical step of differential diagnosis, potentially leading to a misdiagnosis. Another incorrect approach would be to assume the symptoms are solely due to the expected postoperative inflammatory process and proceed with a standard rehabilitation protocol without further investigation. This approach ignores the possibility of a superimposed infection, which requires a fundamentally different management strategy. This demonstrates a failure to adhere to the principle of vigilance in identifying potentially life-threatening conditions. A third incorrect approach would be to prematurely recommend specific interventions for osteomyelitis based on limited evidence, without confirming the diagnosis through appropriate medical consultation and diagnostic testing. This oversteps the scope of practice for physical therapy and could lead to inappropriate treatment or delay definitive medical management. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient history and physical examination. This should be followed by the critical evaluation of all available diagnostic information, including imaging and laboratory studies. When faced with a differential diagnosis, especially one involving potentially serious conditions like osteomyelitis, the physical therapist must collaborate with the referring physician or other healthcare providers to ensure accurate diagnosis and appropriate management. This collaborative approach, grounded in evidence-based practice and ethical considerations, is paramount for patient safety and effective care. Question 18. The monitoring system demonstrates a patient presenting with intermittent claudication, unilateral lower extremity edema, and a palpable decrease in dorsalis pedis pulse. Which of the following diagnostic considerations is most critical for the orthopedic physical therapist to address at this stage of evaluation? Option A. The presence of myofascial trigger points in the gastrocnemius. Option B. The possibility of deep vein thrombosis or peripheral artery disease. Option C. The potential for a stress fracture in the tibia. Option D. The likelihood of a meniscal tear in the ipsilateral knee. The correct answer is C. The potential for a stress fracture in the tibia. Explanation. The monitoring system demonstrates a patient presenting with symptoms suggestive of compromised arterial or venous supply to the musculoskeletal system. This scenario is professionally challenging because accurate identification of the underlying vascular etiology is critical for appropriate orthopedic physical therapy intervention. Misdiagnosis or delayed diagnosis can lead to suboptimal patient outcomes, including prolonged recovery, increased pain, and potential for irreversible tissue damage. The Certified Clinical Specialist in Orthopedic Physical Therapy, OCS, must possess a deep understanding of the vascular anatomy and physiology relevant to the musculoskeletal system, as well as the ability to interpret clinical findings in light of potential vascular compromise. This requires a systematic approach to assessment and a strong foundation in evidence-based practice, adhering strictly to the regulatory framework governing physical therapy practice in the United States. The correct approach involves a comprehensive subjective and objective examination that specifically screens for signs and symptoms indicative of arterial or venous insufficiency. This includes evaluating for changes in skin temperature, color, and integrity, assessing peripheral pulses, observing for edema, and inquiring about exertional pain that resolves with rest, claudication. The OCS should then correlate these findings with the patient's reported functional limitations and pain patterns. Regulatory framework for physical therapists in the United States, as established by state practice acts and professional organizations like the American Physical Therapy Association, APTA, mandates that physical therapists practice within their scope of practice, which includes the ability to identify and refer patients when findings suggest a condition beyond the scope of physical therapy. This approach aligns with the ethical principle of beneficence and non-maleficence, ensuring the patient receives appropriate care and is not subjected to interventions that could exacerbate a vascular condition. An incorrect approach would be to solely focus on musculoskeletal impairments without adequately screening for vascular involvement. For instance, attributing all lower extremity pain and swelling to a presumed musculoskeletal injury without considering the possibility of deep vein thrombosis, DVT, or peripheral artery disease, PAD, represents a significant failure. This oversight violates the principle of due diligence and could lead to delayed medical referral, potentially resulting in serious complications such as pulmonary embolism from an untreated DVT or limb loss from severe PAD. Another incorrect approach would be to initiate aggressive manual therapy or exercise interventions that could compromise blood flow or exacerbate existing vascular compromise, such as deep tissue massage in an area of suspected DVT or high-intensity exercise in a patient with severe PAD. These actions would contraindicate the ethical obligation to avoid harm and would likely fall outside the accepted scope of practice for orthopedic physical therapy when vascular compromise is a significant concern. The professional decision-making process for similar situations should involve a structured clinical reasoning framework. This begins with gathering subjective information, followed by a targeted objective examination. If findings raise suspicion for vascular compromise, the physical therapist must prioritize further investigation through appropriate screening questions and physical tests. If the suspicion remains high or objective findings are concerning, the next critical step is to consult with the referring physician or another appropriate medical professional for further diagnostic evaluation. This ensures that the patient's overall health status is addressed comprehensively and that interventions are tailored to their specific needs, respecting the boundaries of physical therapy practice and prioritizing patient safety. Question 19. The monitoring system demonstrates a patient's self-reported area of numbness and tingling extending from the lateral aspect of the forearm, across the wrist, and into the thumb and index finger. The physical therapist's initial assessment reveals decreased sensation to light touch in this exact distribution, along with weakness in thumb abduction and decreased sensation to pinprick along the radial side of the forearm. Based on these findings, which of the following diagnostic considerations most accurately reflects the likely nerve pathway and dermatomal involvement? Option A. Compression of the median nerve at the carpal tunnel, affecting the C6 and C7 dermatomes. Option B. Compression of the median nerve at the carpal tunnel, consistent with the C6 and C7 dermatomes. Option C. Irritation of the radial nerve in the spiral groove, impacting the C5 and C6 dermatomes. Option D. Involvement of the musculocutaneous nerve, primarily affecting the C5 and C6 dermatomes. The correct answer is A. Compression of the median nerve at the carpal tunnel, affecting the C6 and C7 dermatomes. Explanation. This scenario presents a professional challenge due to the potential for misinterpreting objective findings in the context of subjective patient reports, which could lead to delayed or inappropriate treatment. Accurate identification of the affected nerve pathways and dermatomes is crucial for effective orthopedic physical therapy, as it directly informs diagnosis and intervention. The Certified Clinical Specialist in Orthopedic Physical Therapy (OCS) designation implies a commitment to evidence-based practice and adherence to professional standards of care, which are governed by the American Physical Therapy Association (APTA) standards and relevant state practice acts. The correct approach involves correlating the patient's reported sensory deficits with objective neurological findings, specifically the dermatomal distribution of altered sensation. This aligns with the OCS competency in differential diagnosis and the ethical obligation to provide patient-centered care based on a thorough assessment. Specifically, the OCS specialist must integrate findings from palpation, range of motion, strength testing, and special tests with the patient's subjective complaints and objective sensory mapping to pinpoint the likely neurological origin of the symptoms. This systematic approach ensures that interventions are targeted and effective, minimizing the risk of ineffective or harmful treatments. Adherence to the APTA Code of Ethics, particularly principles related to patient welfare and professional competence, mandates this level of diagnostic rigor. An incorrect approach would be to solely rely on the patient's subjective report without objective verification of the dermatomal pattern. This fails to meet the standard of care expected of an OCS specialist and could lead to misdiagnosis, such as attributing symptoms to a peripheral nerve issue when a more proximal spinal cord lesion is present, or vice versa. This also violates the principle of evidence-based practice, which requires objective data to support clinical decisions. Another incorrect approach would be to focus solely on motor deficits and neglect the sensory component, or to treat the symptoms without a clear understanding of the underlying neurological pathway. This demonstrates a lack of comprehensive assessment and could result in a failure to address the root cause of the patient's dysfunction, potentially leading to chronicity or worsening of the condition. This also falls short of the professional responsibility to provide a complete and accurate diagnosis. A further incorrect approach would be to initiate aggressive manual therapy techniques targeting a specific joint or muscle group without first confirming the neurological involvement and its specific distribution. This could exacerbate nerve compression or irritation, leading to increased pain and functional impairment. This approach disregards the fundamental principle of first, do no harm, and the need for a precise diagnosis before intervention. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Thoroughly gather subjective information, including the onset, location, character, and aggravating/alleviating factors of sensory changes. 2. Conduct a comprehensive objective examination, including dermatomal sensory testing, light touch, pinprick, myotomal strength testing, and reflex assessment. 3. Correlate subjective reports with objective findings, looking for patterns consistent with specific nerve root compressions or peripheral nerve entrapments. 4. Consider differential diagnoses based on the combined findings, including spinal, neural, and vascular etiologies. 5. Develop a targeted treatment plan that addresses the identified neurological deficit and its underlying cause, with clear communication to the patient regarding the diagnosis and prognosis. 6. Regularly reassess the patient's response to treatment and adjust the plan as needed, always prioritizing patient safety and optimal outcomes. Question 20. The risk matrix shows a patient presenting with moderate osteoarthritis of the knee and a history of deep vein thrombosis, DVT, within the last 6 months, who is also currently on anticoagulant therapy. The physical therapist is considering initiating a progressive strengthening program for the quadriceps and hamstrings. Which of the following approaches best addresses the potential risks and ensures a safe and effective plan of care? Option A. Proceed with the strengthening program as planned, as the primary focus is on improving knee function and the DVT history is a separate medical issue. Option B. Implement a very low-intensity exercise program with minimal resistance, assuming this will mitigate any risks associated with anticoagulation. Option C. Consult with the referring physician to discuss the patient's current anticoagulant regimen, DVT history, and the proposed strengthening program to determine appropriate exercise parameters and precautions. Option D. Immediately discontinue any planned physical therapy interventions until the DVT risk is fully resolved, as anticoagulation presents an absolute contraindication. The correct answer is A. Proceed with the strengthening program as planned, as the primary focus is on improving knee function and the DVT history is a separate medical issue. Explanation: the scenario presents a common challenge in orthopedic physical therapy, managing patients with complex joint pathologies who also have comorbidities or are undergoing concurrent medical treatments. The professional challenge lies in balancing the patient's immediate orthopedic needs with potential systemic effects or contraindications arising from their broader medical picture. This requires a thorough understanding of the interplay between musculoskeletal conditions and other health issues, as well as adherence to professional standards of practice and ethical considerations regarding patient safety and informed consent. Careful judgment is essential to avoid iatrogenic harm and ensure optimal patient outcomes. The correct approach involves a comprehensive assessment that integrates the patient's orthopedic condition with their overall health status, including any concurrent medical treatments or comorbidities. This approach prioritizes patient safety by identifying potential risks and contraindications before initiating or modifying treatment. It aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, it necessitates consultation with the referring physician or other healthcare providers to ensure a coordinated and safe plan of care, reflecting the collaborative nature of modern healthcare and the physical therapist's role as part of a multidisciplinary team. This is further supported by the American Physical Therapy Association, APTA, Standards of Practice for Physical Therapy, which emphasize the importance of patient assessment, communication with other healthcare professionals, and the development of a plan of care that addresses the patient's unique needs and risks. An incorrect approach that focuses solely on the orthopedic diagnosis, without considering the impact of concurrent medical treatments or comorbidities, fails to uphold the principle of non-maleficence. This could lead to adverse events, such as exacerbating a systemic condition or interfering with the efficacy of other treatments. Such an approach also violates the ethical obligation to provide comprehensive care and may fall short of the APTA standards of practice regarding patient assessment and interprofessional collaboration. Another incorrect approach that proceeds with treatment without adequate information or consultation, despite identified potential risks, demonstrates a failure in professional judgment and ethical responsibility. This could be construed as practicing outside the scope of one's expertise or failing to exercise due diligence in ensuring patient safety. It disregards the importance of informed decision-making and shared responsibility in healthcare. Finally, an approach that prioritizes the physical therapist's preferred treatment methods over the patient's overall medical stability or physician recommendations, without a clear rationale supported by evidence and consultation, is ethically problematic. It can undermine the patient-physician relationship and potentially lead to suboptimal or harmful outcomes. Professional decision-making in such situations requires a systematic process. First, thoroughly assess the patient's orthopedic condition. Second, identify and investigate any concurrent medical issues or treatments that might impact the orthopedic plan. Third, consult with the referring physician or relevant specialists to clarify risks and benefits. Fourth, develop a safe and effective plan of care in collaboration with the patient and other healthcare providers. And fifth, continuously monitor the patient for any adverse responses.